Okay, we're talking about brain tumors. They're not that common. 1 in 450 people are living with a brain tumor. We have Dr. Paula Roshkalb here, and she's the medical director of neuro-oncology unit at Intermountain Medical Center to talk about, it is brain surgery, but what's this new high-tech thing?
This is something that's kind of a novel approach to treating brain tumors. What's interesting about it is just that it's unlike anything that we've really tried before, and it sounds very different. It sounds kind of unusual to most people, a little unorthodox an approach.
Okay.
It's electrical. It's an approach to trying to stop rapidly dividing cells, cancer cells, from dividing, which is really what we try to do with chemotherapy and radiation.
Right.
But what we're doing now is taking advantage of the fact that when these cells divide, they have to form structures within the cells, and those structures rely on polarity, positive and negative.
Okay, so the electric charges kind of take away the growth.
Even at the molecular level, we all have positive and negative electrical fields going on all the time. What we're trying to do here is interrupt it. So it kind of alternates between positive and negative, and to oversimplify, kind of confusing the cells that are trying to divide and stopping the process.
Like chemo, but with electricity instead of chemicals.
Exactly.
Okay, now real quick, we don't want people to be paranoid that they have a brain tumor, but what are some real symptoms? At least get it checked.
Right.
When should you, what are some of the symptoms?
So one of the primary things that everybody hears about and worries about is headache. And certainly by far, the vast majority, I can't even come up with a number, but vast majority of headaches have nothing to do with tumors. So you're right, I don't want people to worry, I have a headache, do I have a brain tumor? The characteristics that we most often talk about that might indicate that you need to get something checked out: gradually progressive. So not kind of this come and go migraine, but it's worsening and worsening over time. Okay. Worse when people have been laying down for a long time. So in the mornings, a morning headache that's worse, rather than something that gets worse throughout the day, as often happens to us.
Nausea or...
Right, nausea that you can't otherwise explain. So you're not ill, you haven't eaten the wrong thing, the nausea is not stopping no matter what you do. Then you might think that this could be due to pressure in the head, in the brain, from a tumor. Things like vision loss, that can happen with a number of neurological things. So stroke can cause vision loss. So if suddenly you lose kind of one area of your vision, that would be something. Because the fact that your vision is blurring and maybe you need new glasses, that's a little more general. Right. So something that's kind of a specific visual field that's gone. The ability to speak. That can happen in stroke. Right. If it's rapid onset, you always think of stroke, but also this can happen as a more gradual process, so change in speech patterns.
Still, all of these symptoms are things worth getting checked out if they're severe.
Absolutely.
Okay.
Absolutely.
And you can get a hold of the neuro-oncology unit at Intermountain Medical Center.
Yes.
Okay, thanks so much.
Thank you.
We will take a break and be right back.